Coming up on this edition of Being Well, Dr. Bernie Ranchero from Sarah Bush Lincoln Health System will be here to talk about memory issues such as dementia and Alzheimer's disease. We'll learn more about the early warning signs and if things like brain training and supplements are actually preventative in nature. That's all coming up next on this edition of Being Well, so stay right where you are. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Thanks for joining us for this edition of Being Well. I'm your host, Lori Casey, and today we're talking about memory issues and related illnesses with Dr. Bernie Ranchero with Sarah Bush Lincoln Health System. Thanks for coming back to the show.
Thank you for having me.
Well, when do you or other doctors start seeing patients with memory issues? Is there a typical age of onset?
Sure. Generally, we start seeing patients with dementia or signs and symptoms of dementia, early stages, after the age of 60. Now that said, have I seen patients with early onset Alzheimer's, early onset dementia at age 30 and 40, even and 50? Yes, and generally those are patients that have some genetic disposition or genetic condition that they suffer from that predisposes them to a dementia or memory or cognitive problem.
Okay, so you mentioned dementia and Alzheimer's. Are they the same thing or two totally different things?
That's a great question. Alzheimer's is a part of dementia.
Okay.
Dementia just means that a person has a problem with their memory, with their cognitive abilities. Mm-hmm. And Alzheimer's is the most common form of dementia.
Okay, so in dementia, is there something, what's happening in your brain? Explain kind of the science of dementia.
Sure. Dementia can be caused by many numerous things. Mm-hmm. As I said, the first is Alzheimer's disease is the most common. But you can have people who suffer from dementia, again, which is just cognitive decline mm-hmm. in memory. That can be due to drugs, alcohol, medical conditions, patients that even suffer from depression, mm-hmm. patients who had brain injuries, patients who have problems with poor perfusion or oxygenation to the brain.
Okay.
Vascular dementia, that's the second most common.
Okay, but Alzheimer's actually there is something different happening in the brain.
Correct. What we do know pathologically what's going on with Alzheimer's disease is that we get neurofibrillar tangles and amyloid plaques. Mm-hmm. And why these happen, we necessarily don't know. But if the most definitive way to diagnose someone with Alzheimer's is by doing an autopsy and looking at the brain and seeing these plaques and these tangles, mm-hmm. and actually seeing parts of the brain that have shrunk.
Okay, so is Alzheimer's a fairly new disease, or do we think people always had it and it's just now that we have kind of put a name to it?
Alzheimer's was first, I guess, named in 1906 by Dr. Alzheimer.
Okay.
He had a patient that he noticed had this cognitive decline, had memory problems, speech problems, and eventually couldn't perform any of her activities of daily living, couldn't function. And then he performed an autopsy on the brain and found these unusual hallmarks in the brain, those plaques and tangles. Mm-hmm. And ever since then, they've found that as we age, we're at higher risk for developing Alzheimer's disease and this dementia.
Okay, so how do you know? I mean, I get forgetful and scattered some days and can't, I've lost my keys. I can't remember where I left my purse, although we've all had that before. Mm-hmm. How do we know when it's something more than just don't have my act together today, and
Sure.
It could be something more?
I think a lot of it is going to your doctor, or if you're concerned, if you have a family member that you're concerned is suffering from dementia, Alzheimer's, going to the doctor and making sure there's not other causes. Mm-hmm. Again, are they depressed? Do they have a problem with their electrolytes? Do they have a problem with perfusion, getting oxygen to their brain? Are there other things that are going on? So getting lab tests, getting diagnostic exams of the brain, having neurological tests done, asking questions about their memory and asking questions of can they do math, can they do word questions. Mm-hmm. Your doctor can do tests to determine are there signs of some sort of cognitive dysfunction going on there. But sometimes it's really the family saying something's gone on with this loved one. The way they're handling money, the way they're driving. The beginning stages of dementia and Alzheimer's as a stage we call mild cognitive impairment. The inability to learn. They're asking the same questions over and over again. A spouse can't be corrected, or the other spouse is saying they just don't get it, and they're not learning. So it's simple things like that you start to notice that, wait a second, there's been some change in personality, some change in behavior, some change in the way this person operates.
Okay. So are there outside things, though, like stress, you had mentioned depression, or even trauma that can trigger that or bring on dementia?
And those are things that we need to look out for, because we do know patients that suffer from Alzheimer's and dementia, they get worse when they're in a new environment. They get worse when things are changed. They get worse when they get stressed out. Sometimes the worst thing you can do for an Alzheimer's patient is continually change their environment. I knew a family, it was a large family, and they continually shipped grandma from house to house to house to house. And her behavior got worse, worse, and worse. Because one of the best things you can do to help support an Alzheimer's patient is give them a structured environment. Give them an environment that they know what's going to happen, that there's going to be a routine, that it doesn't change.
So how do you, when you have a patient come in that is diagnosed with, those early stages, that's a tough thing to take in and realize this is what I'm going to live with. How do you help that person accept that and then sort of move forward from that diagnosis?
Sometimes it's just letting the person know that I want to help them, help them to realize that things have changed, that maybe their thinking has gone down, that their memory has changed, and it could be letting them know that through tests that, okay, things have changed, that in the future that we might need to make some changes, and that what are their wishes and what are their wants, and that we don't want to do anything that would make them scared or fearful, and let them know that we're going to give them as much control as we can give them, but that they're cared for, and they're going to be cared for.
Does it progress faster in some people, slower in others? Is there anything that gives you any indication that it will progress quickly?
I think a lot of it also has to do with the type of dementia that you do have. Vascular dementia and other types of dementia can get worse significantly fast versus Alzheimer's disease, which usually is a slow progression. Maybe over months and years, they're unable to dress themselves, feed themselves, bathe themselves. But usually that's over months to years. Not all of a sudden, one week they can do something and the next week they can't.
So why is the vascular a lot faster than Alzheimer's?
Parts of the brain are dying because of strokes or oxygenation. And so we actually, with Alzheimer's disease, parts of the brain do shrink and atrophy, but it's at a more steady decline versus a rapid week to week, month to month, or even day to day.
So do you find that the dementia, Alzheimer's, is it hereditary?
There is a genetic component, definitely, but there's also environmental factors, and there's also dietary factors. And there's also things we can do. Yes, we can't change your genetics. Can we somewhat modify our environment? Yes, but there's other things that we can do to help prevent dementia, also Alzheimer's disease, but also prevent the decline into worsening Alzheimer's disease.
So let's talk about some of those preventative things that we can do to hopefully stave off things like this.
From a young age, number one is use safety equipment. We do know that someone that is more likely, or the more head injuries, the more concussions, the more injuries to the brain that a person suffers from, they will develop Parkinson's disease, dementia, Alzheimer's disease. I mean, we could look at football players, boxers, professional athletes, people who have head injuries. They are more likely to develop Alzheimer's disease and dementia. Staying active. One thing, a study that came out decades ago showed, it was a study on nuns. And they looked at, the nuns were willing to donate their brains to science later on. And they said, and they were trying to look at, can we predict those people that have Alzheimer's? And what was found when they did the autopsies at the end, when the nuns passed away, is the nuns that even though their brains looked like they had Alzheimer's and dementia, they didn't have any symptoms. Why? They stayed active.
active physically, mentally, or both?
Both.
Okay.
And really what we're seeing is staying physically active is very important. And I think part of that also has to do with getting oxygen to the brain, getting the right amount of nutrients. And then also, but staying mentally active, staying social, challenging your mind, doing something you enjoy, and not just being sedentary and laying back.
So we see, there's all these programs out there for brain training. Does that work? I mean, is that going to make it so I don't have dementia later on in life?
I think the studies are not showing that. I don't know if there's positive proof of that. However, what I'd say is that can definitely help keep you sharp. Because if you do have the genetic disposition and you've had the environmental factors, maybe the brain injuries, maybe nothing will help prevent it. However, knowing that, I think keeping active and keeping your mind active definitely would help.
Because what is that, when you do stuff like those brain training exercises or even crossword puzzles and reading, what does that do to your brain?
It's making connections. It's keeping those connections, those neurons. Your brain is made of brain cells, nerve cells, neurons. So by doing those things, by challenging your mind, you're reactivating those connections, you're firing those connections, and you're keeping those connections alive.
Because when you have like Alzheimer's, is it those connections just quit?
Correct.
It quits making new ones?
That is correct.
Okay.
Oftentimes what you'll see with Alzheimer's patients is parts of the brain actually shrink. Wow. Parts of those neurons die. And we see that. I've seen CT scans and MRs, magnetic resonance imaging of patients' brains. And when you see an Alzheimer's patient or a patient that suffers from dementia, their brain is actually smaller.
Wow. So ways to prevent are, keep active physically and mentally. What about diet and, how much we weigh? Weight seems to play a big role in all sorts of medical conditions.
We do know now that obesity, when people carry a lot of adipose tissue or fat, it's not just fat, it's an endocrine organ. It's producing oxidants, it's producing free radicals. Free radicals damage your cells. Brain cells, neurons cannot regenerate themselves. So if we can stay a healthy weight, that'll also help us to maintain good blood sugars, prevent hypertension, prevent high cholesterol, and all those things, by staying healthy, will help our brains to stay even healthy. Now, can we eat well? Eating our 5 servings of fruits and vegetables a day, keeping our brain active, making sure we're getting a lot of antioxidants, which are in the fruits and vegetables, or taking supplements. We do know people with higher levels of vitamin D, for instance, not only do they live longer, but they have a lower incidence of developing Alzheimer's and dementia.
What about other types of supplements? In the materials you gave me, is it one ginkgo biloba? Natural supplements, are there things that we can take?
You know what, I think when it comes to the natural supplements, the studies go back and forth. But one of the most important things I tell my patients, especially when it comes to supplements, if it helps you and it does no harm, then I don't have a problem with it. And the reason I say that, the reason that the FDA and the pharmaceutical community does placebo-controlled studies is because 30 to 40% of the time, you're going to get better and you will respond because you think you're going to get better. I remember when my niece and nephew were younger, and they'd say, oh, I have a headache, or I've got this, I've got that. I'd give them a Tic Tac, and they'd get better. Later on, as they got older, they'd say,
this tastes a little bit like a Tic Tac,
Uncle Bernie's giving us a Tic Tac. And I say, well, but it worked because they thought it would get better. And sometimes supplementation and herbs and other things like that, more alternative complementary medicine, sometimes it's a matter of the mind over the body, and that's why it's powerful, and that's why it works.
But any supplements you take, you probably need to run those by your doctor.
Correct.
To make sure that they don't
do not cause harm. That's the most important thing. Do no harm.
Okay, so let's talk about we'll speak specifically to Alzheimer. As it progresses and gets worse, what kind of starts to happen to that patient? They probably see an increase in other types of medical problems?
Yes, and I think once you start to develop, going from there's 3 stages of Alzheimer's: mild Alzheimer's, moderate, and then severe. And again, you might see in the mild cases that they're able to function. They can live independently. Maybe they need cues. Maybe they need just a minor amount of assistance. But as the disease progresses, they will need more and more care, more and more support. And unfortunately, oftentimes that patient is not aware that their hygiene is not good, that they're not eating correctly, that they're not dressing correctly, that maybe unfortunately they're doing things that are unsafe. And we oftentimes see that unfortunately when someone's driving. Maybe they're getting into more accidents. Driving can be a very, very complex and complicated task. They're doing things that because they can't process all the stimuli that's coming at them and what they need to do.
Right. So what kinds of care are available?
Well, I think that it really depends on that person and their family structure and the support systems they do have. You know, it's nice, obviously, if a person can remain in their house and maybe they have a caregiver, whether it's a relative or someone they hire out. I think that's a great option. But sometimes that doesn't become an option, and the best thing to do is to get more formal support for that patient, which can include, first of all, going to a place that has independent living, where they cook for you, where they clean for you, where they make sure you're getting the things you need to get done, where you don't have to worry about those things that are important, but you can have someone else doing for you. And then maybe as the disease progresses, you go to an assisted living or supportive living where someone is actually helping you with your medications. Maybe they're helping you to get dressed. Maybe they're helping you to eat. Maybe they're helping you, reminding you of the medications to take. And then eventually as the disease progresses, they need to go to a memory care unit where they're basically assisting you with everything, with all your activities of daily living. And eventually in the severe stages of Alzheimer's disease, you'll need to be placed in a skilled nursing facility where everything's being done and you're being medically monitored.
Are you, in the research you've done, is there an increase in Alzheimer's here in the U.S.?
It's interesting. Statistics show there's about 10 million people out in the U.S. that have Alzheimer's disease. About 5 million are diagnosed and another 5 million are not diagnosed.
Really?
So it's quite a large percentage now. And what we're seeing, though, is that the baby boomers are now reaching the age of 65. And because of advances in medicine, we're living longer. And so, yes, are we seeing more Alzheimer's? Yes, because we have an aging population and people are living longer.
What about in the dementia? Are we seeing more cases of that because of things like head traumas and other things?
Yes, we are seeing more dementia just because Alzheimer's is growing so much.
Okay, so it's on the increase.
Yes.
Dr. Ranchero, as we wrap up, give us some advice on what we can do now to help prevent things like Alzheimer's and dementia later in life.
Sure. Number one, stop smoking. If you smoke, stop smoking. Number two, exercise. Stay active. Again, if you're obese, lose weight. But even if it's walking 10 minutes a day, I laugh at patients and I say, "Do you have a dog?" And if they say no, I said, "Pretend you have one. Go for a walk." So get to a healthy weight, and then eat well. Eat your 5 servings of fruits and vegetables. Decrease the amount of sugar-sweetened beverages you're drinking. If you can increase, if you need to take supplements and antioxidants, do that as well. But just simple things, lifestyle things that we can do in staying active and staying healthy.
All right. Well, thank you for coming by to the show again and giving us some great information and advice on memory issues and Alzheimer's and dementia.
Thank you, Lori.
Just about everyone searches the internet now and then for health information, but for some that searching becomes an obsession. They spend hours worrying and looking at causes for symptoms until they're convinced they have a deadly disease. It's called cyberchondria. Doctors at Mayo Clinic see people who struggle with it and they have advice on how to manage it.
I'm checking all the time.
When Jennifer Koski gets a symptom, maybe a headache or a rash, she hits the internet to learn more.
There are horrible pictures of rashes online, right? And part of you says, well, thank goodness mine doesn't look like that.
But for people with health anxiety, which Jennifer does not have, the glut of health and medical information on the internet can fuel worries.
Sometimes you assume things are worse than they are because of what you see. And instead of maybe just having it be a little dermatitis, you're thinking, now I have a skin cancer.
It's called cyberchondria, searching the internet because of illness anxiety, but that searching makes the anxiety worse.
I have worked with individuals who spend 5 to 6 hours a day, every day on the internet.
The worst things you can feed into is you start looking at these symptoms lists, but you start talking yourself into some of the other symptoms, I think, or you worry that you have them.
Instead of being reassured by the information, it heightens your anxiety until you're convinced that something is very, very wrong. Blogs with comments from people who are not health experts, while sometimes helpful, can also be problematic for people with cyberchondria.
You know, if I didn't know better, I might start panicking a little bit about some of the scary things they're saying could be happening and what I should be doing.
Now, Jen's able to keep all this in perspective, but the question is, when does it become a problem for which you need to shut the computer and get some help?
But it needs to be treated. When it gets to the extent that it's governing people's lives, causing them interference with their day-to-day functioning, their roles with their family.
Mayo Clinic psychologist Dr. Richard Syme says that's when it's time to talk to a healthcare professional. He says cognitive behavioral therapy, or CBT, can help break the cycle of searching and calm fears. It involves helping people weigh the evidence that a symptom such as a stomachache is more likely to be a benign condition than a deadly one. It also helps people learn to live with their uncertainty and reassure themselves when they experience distressing sensations or symptoms. And it helps get people off the internet and back into life.
But I'm pretty good about stopping myself and saying, okay, common sense.
But if you can't stop yourself, take Dr. Syme's advice and reach out to healthcare professionals who can help. For the Mayo Clinic News Network, I'm Vivian Williams.
This is a story of beating the odds. It's about a man who developed a potentially deadly complication of the flu called acute respiratory distress syndrome, or ARDS.
Do you mind if I take a little listen to your lungs too?
For almost 2 months, a critical care unit was home to Sean Krause, but he doesn't remember any of it.
I believe I was under for 45 days.
Unconscious, on a ventilator to help him breathe, after a case of the flu turned into a potentially deadly condition called ARDS.
It's an acronym for acute respiratory distress syndrome, which it's a form of acute lung injury. In other words, the lung, the tissue of the lung has been injured by something. And this is kind of the classic ARDS picture where we have these dense consolidations on both sides of the lung.
Mayo Clinic Dr. Richard Oakler says that something could be a traumatic injury, a bacterial infection, or in this case, a flu virus.
And sets off a big inflammatory response. And that inflammatory response is really at the heart of this ARDS.
Here's what happens. Your lungs are made up of millions of tiny air sacs. They're in constant contact with your bloodstream, which carries oxygen throughout your body. Normally, barriers prevent water in your bloodstream from flowing into your lungs. When ARDS strikes, barriers break and fluid fills your lungs.
That brisk inflammatory response in the lung now can pass through the bloodstream and throughout the body. And so you get a bad systemic response that can lead to other organ failures and ultimately the death.
Dr. Oakler says close to 40% of all people who develop ARDS don't make it.
I think my lucky stars now, I know that.
Sean's treatment included medication to target the underlying infection and a ventilator to support his lungs.
Ventilators or the breathing machines are really life-saving because we were really able with the machine to help him breathe while his lungs were healing.
Dr. Jeff Rabotin heads the respiratory care unit at Mayo Clinic. He says for many patients like Sean, ARDS can be very tough. There was a time, Sean says, when his family gathered because things looked grim.
They didn't expect me to live. How close I was to, pushing daisies, if you want to say.
But Sean did pull through. Every day he's getting stronger, healthier, and ready to head home, back to life.
I'm just thankful to be here.
For Mayo Clinic News Network, I'm Vivian Williams.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Being Well is also available online at our YouTube channel, youtube.com/WEIUTV. Just look for the Being Well playlist. Here you can view current as well as past episodes.